Hi, I'm Johnny.
And I'm Wayne.
Welcome to Planet Health.
Today, October 15th and December 7th, Medicare eligible members can enroll for plans for 2025. Let's cover the basics. You got kind of four very distinct types of plans. Medicare Part A, which is original Medicare, and for the most part, this covers inpatient hospital costs. You got Part B, which is outpatient, which is any specialty and outpatient services is typically covered under Part B. Part C, what is also known as Medicare Advantage, is a combination of Part A and B. And in many cases, it also includes Part D, which is the drug plan. Members typically have an option to either elect Part A and B, going with original Medicare, or going with a private health insurance that offers Medicare Advantage or Part C. And for most people, when you first start signing up for Medicare, this could be very complex. But let's cover some of the basics. Wayne, do you want to walk us through some of these options?
So thanks, Johnny. So Medicare A and B are what you get if you've worked for 40 quarters or 10 years and you're paying into the Medicare tax. And that's what you get. You get Part A rather, as a benefit that you sign up for once you sign up for your Social Security. It pays 80% of your hospitalizations, basically. And Part B is something you become eligible for, and you have to pay a premium to the government, and it's typically deducted directly from your Social Security benefit, and that covers your outpatient, as Johnny said. So that includes labs, includes imaging, physical therapy, occupational therapy, and your primary care and specialty care physicians. Now, those two options, the A and B, those that you can select, but you still have to select them in order to get them, and that's when you sign up for Social Security. Everything is all wrapped together. Now, you can also, if you have Part A and Part B, you can also select what's called Medigap insurance or supplemental insurance, and that's offered by private insurers that will supplement the benefits that you're getting under Part A and Part B, and that really typically covers the 20% that Medicare doesn't cover. And then on top of that, you have to select a Part D. Everybody has to select a Part D plan, and the Part D is the coverage for your drugs, and that's all only offered by private insurance. And so that's why this is a little bit complicated. And the reason why open enrollment is really important is because that's when Part C, or the Medicare Advantage plans, you get the opportunity to select one of them. And so Medicare Advantage is, again, run by a private insurance company, and they've bundled together the benefits from Part A and B, as well as usually Part D. So they're called MAPD plans. And they're offered by, these are the ones that will be sending you lots of things in the mail saying that, oh, you should try us. And one of the things that you should consider is that Medicare Advantage plans offer what's called supplemental benefits. And those can be actually very, very useful and helpful because Medicare, original Medicare, doesn't offer a lot of things. It's just your typical health insurance. So the Medicare Advantage plan might offer food delivery after being hospitalized. It might offer transportation, might offer dental benefits. There's a whole bunch of various things that they are using to entice people to join the Medicare Advantage plans. And just like with commercial insurance, they have different types of plans. They have HMO plans where you have a primary care doctor that you have to go through to get referrals to do specialists and tests and things like that. Or they have a PPO plan, which is a little bit like the original Medicare plans, but they may still be able to offer you some additional benefits outside of what traditional Medicare offers. It's a little complicated. I think you can get help though, because Medicare offers a website, medicare.gov, where you can actually compare the different plans. Medicare also has a 1-800 number that you can call and speak to somebody. It's 1-800-MEDICARE or 1-800-633-4227, and you can call them and you can talk to them. They also have, each state also has a state health insurance assistance program, or SHIP, and you can call 1-877-839-2675, and a SHIP counselor can help review options that are available in your area and any special rules that may apply to your state. It's important to do this regardless of whether or not you've decided that you want to stick with your plan or you want to change from fee-for-service into a plan or vice versa. And the reason why is because every year these plans will offer potentially different supplemental benefits. And while one year the benefit might be great, another year it might not be the same. And so it's really important to sort of check around and make sure that whatever you're signing up for is actually what's going to be helpful to your particular condition. And so besides the nonprofit organizations, the SHIPs, you could also go to a broker, and these brokers are trained specifically to help you understand your Medicare benefit and also what the plans that they're offering might help in terms of additional benefits that may benefit your particular medical condition.
Speaking of comparing plans, we actually have some changes coming up in 2025.
Yep.
Medicare's gone through some pretty significant refresh for these plans. So could you highlight three changes that are coming up for 2025 that perhaps folks may want to know about?
Yeah, so the first thing I think is important is there's a cap on drug costs, right? And so this affects everyone on Medicare, regardless of whether you're in a plan or you're just doing original Medicare. Because as long as you have Part D, there is a cap of $2,000 per year on the drug costs out of pocket. The second thing is a payment plan. So before you had to basically pay up front, and that could be extremely expensive. And so now you can actually spread out your costs, your prescription drug costs, over monthly payments throughout the year. Now, this will be the first year that they're doing this, so it might be a little bumpy, but at least it gives you an option to be able to distribute those costs throughout the year as opposed to having to pay all up front. And the final thing that I think is important to know is that the members that are choosing Medicare Advantage, those supplemental benefits typically may not be completely used or even known about. And so the plans are required to send a mid-year notice to beneficiaries in Medicare Advantage plans about the supplemental benefits that they still have or should be able to take advantage of.
Thank you, Wayne. That's very helpful. For those that are considering Medicare Advantage plans, how do you go about shopping for the right plan? Because it could be very daunting. And, when I first started in this industry, this isn't your typical open enrollment process where you have with your employer, you have potentially 2 or 3 plans. In some counties, you probably have 20 plus plans. What are like the top 5, 6 criteria that you would recommend a new member look through when they're looking at Medicare.gov website?
So I think it really applies to every beneficiary, regardless of whether or not you're in a plan right now or you're in fee-for-service or original Medicare. And then again, the reason why is because plans change. New plans can enter a county, and so you want to take a look at what is available so that you can make an educated decision as to what plan will best fit your needs. And the first thing to look at is the star rating. Now, plans will have star ratings. The fee-for-service original Medicare doesn't have a star rating. So the plan has a star rating, and the rating is based on both quality as well as patient satisfaction. And both of those things are extremely important because you want to know that the plan is able to provide services that meet the medical necessity or evidence-based criteria to treat patients with a particular condition. So the quality measures are typically on like diabetes or cardiac care, rheumatologic care, various different disease states, but also it does measure the members' satisfaction with the plan and with the providers that are in the plan. And what's important about this is that this is done across the board and is essentially a level set so that, just because a plan is saying great things, you want to know whether or not they're actually providing the services that you're going to need. Now, what's interesting is that this year, a lot of plans actually dropped in their star ratings. And why they dropped was because of a sort of calculation that occurred during COVID. So as you know, during COVID, a lot of offices were closed and a lot of patients did not want to go into an office because they were afraid of getting sick. And so because of that, Medicare made some adjustments to the star ratings to sort of level set the inability of providers to get patients into the office. And so those exceptions have now been lifted, and now the ratings themselves are pretty much what is actually happening in the office right now with any particular beneficiary of that particular plan. So star ratings would be the first thing that I would look at. I think the second thing is to look at the supplemental benefits. Like I said, every plan is going to offer different levels of benefits that are supplemental to what original Medicare or traditional Medicare has. And that's something that everyone should look at because sometimes those benefits might impact your care. So for example, they may have transportation benefits. They may have benefits for in-home care after a hospitalization. They could have fitness benefits, dental benefits. They have telehealth benefits and even vision benefits. A lot of these benefits are not available in traditional or original Medicare. So if you just have Part A and Part B, you might be missing out on something that might be helpful to you. I think the other thing to think about is the network itself, right? So you want to make sure that the doctors that you're seeing are actually part of the network of the plan that you might consider. And that includes both the primary care network as well as the specialty network. So all your specialists that you're seeing. And sometimes it's important to see those groups, they're usually medical groups, whether or not those doctors are performing well. So sometimes they may have individual physician star ratings as well, so that you can see whether or not they're performing to the standards that Medicare is looking at.
Wait, now on the network, now if a member has an existing physician, what's the best way to check if their physician is actually in network? Kind of what would you recommend?
Yeah, I think that's a great idea. Talking to your doctor to have them help you select a network and also the plan. Although the doctor can't really direct you to a plan, but they can say that this network is what you're going to be needing to manage the conditions that you have. So yeah, talking to your doctor helps. The doctor also will probably tend to talk to you about the drugs that you're on and will help you with the formulary, which is another thing to consider, the formulary and the pharmacy network. The formulary is something that a plan, a Part D plan, will basically list out there saying that these are on the formulary and available, and they could be at different tiers, right? So it could be the lowest tier may not have a copay. They may be all generic drugs. But then as the tiers get higher, there's additional costs that are associated as copays. And this is where that $2,000 out-of-pocket cap comes in, so that you're not going to pay more than $2,000 even if the drugs on the highest tier have high copays. And that's really important. And then the second thing about the Part D plan is the pharmacy network that the plan is asking you to get your medications. No matter what network that is, you should make sure that there's one that's available and close by so that you can get access to it. But you also should consider mail order pharmacy services too, because if you're on chronic medications that haven't really changed in dosage, then you can actually get those usually at a discounted rate with less copays and mailed directly to you. And a lot of people don't take advantage of that, but that's something that you can look at to see if you can help reduce your costs for pharmacy costs. And then I guess the last thing is injectable drugs. So a lot of times the formulary will also have what's called a specialty formulary, which is those drugs that are injectable, things like Enbrel or Ozempic. And those things typically have a large or higher copay and are typically delivered in a special way. They're injectable, so they might come with delivered by FedEx in a cold container, and may also have care managers or nurses that will help work with you to make sure that you're taking those medications appropriately.
All right, that wraps it up. Stay tuned for our next episode.